So it's been 20 years since I moved to Port Pirie. I moved from Chennai. It's a big town in the south of India. So I would say it was merely an accident. I never wanted to leave my country. But Dr. Andrew, who was owning this practice, was visiting Chennai at the time. And through a common friend, he said there was a job available in Port Pirie if somebody wants to apply. And this common friend told me, do you want to try? Because all my family, my brothers live in US, they're all abroad. So I told my wife, let's go for 2 years, let's see what happens. So I attended an interview and then I passed the interview. Then I came here in October 2004. So that's it. I came here and I stayed. My plan was to stay for 2 years, but I continued to stay and I really enjoy staying here. And I've got a family, my kids are, my son was born here. I've got a daughter who is 22, she's in medical school. And my son is doing health science in Adelaide, he's 19. I've lived here for 20 years. This October will be 20 years since I moved to Port Pirie. My daughter is in medicine. She's doing medical school in Flinders. She's doing postgraduate medicine. And like both my kids studied in Pirie till year 8. And then in year 9, they moved to Adelaide to Pembroke to boarding school. So for the last 6-7 years, I've been going to Adelaide every weekend. So like I finish at 3:30 on Friday and then drive. It's about 2.5 hours drive. I stay in the weekend in Adelaide, visit my kids, and then I'm back on Sunday evening to Port Pirie. Before I moved to Port Pirie, I was a surgeon in India. I was a general surgeon. So my plan was initially to come for 2 years to come to a different country and see how medicine is practiced. But then I got the opportunity to work in Port Pirie. But after coming to Port Pirie, I feel that a rural medicine, general practice, makes you a complete doctor. You need to know a little bit of everything. Because here in Pirie, we GPs run the town, the hospital. We look after the patients. There is continuity of care. And Port Pirie is a town where you got a lot of things. So I've got friends who work in neighboring towns like Peterborough, Jamestown. Here in Pirie, you got a 24-hour lab, you got X-rays, you got ultrasound, you got CT scan, you got a defibrillator, you got a theater. So they expect you to do a lot of things here before you transfer the patient to Adelaide, or you can manage them here. So we need to know a bit of everything, and running the emergency department, running the hospital inpatients, doing private clinic, we gain immense experience. And I think as a doctor, experience counts more than reading from a book. And I think Port Pirie is unique because you got everything available. You can learn a lot of things. You can upgrade your skills. You can learn new skills. And especially for interns, medical registrars, and budding doctors, this is an ideal town because they have to learn these things. And if you're working in a tertiary center in Adelaide, somebody comes with a chest pain, you're going to write a letter and say, call the ambulance and send them to the hospital. Here in Pirie, I admit the patient, do an ECG, do a blood test. If the patient has got like an acute infarct, we can thrombolize the patient. We can get advice from the specialist over the phone. And then if the patient is stable, we could continue to treat them here or transfer them to Adelaide for further procedures like angiogram. And we have a continuity of care. And I feel really complete. And I feel like it's a super specialty, I would call rural medicine, rural general practice, because you need to know a little bit of everything. You don't know what will walk into your room. You could see a patient with a snake bite, with a spider bite, a stroke, renal failure, heart attack, everything. And Pirie especially has got the demography of general practice, what we read from the book. We got pediatric patients, we got geriatric patients, we got chronic health, we got women's health, we got mental health, drug and alcohol, so everything. So it really is a nice place, especially for budding doctors and interns to at least spend some time here, which will probably make them feel a complete doctor. Pirie is a very friendly town. Like when I came, it was the first time I moved out of my country. And my wife, it was a big cultural change. She was pregnant. She was about 7 months pregnant with my son. And she can talk English, but not to the extent of what Australians talk. She couldn't drive. But the community took us into, from day one, they were so helpful, so friendly. And we never looked back. Our initial plan was to come for 2 years. But we have never regretted our decision. And it's not far from Adelaide. It's a 2.5 hours drive. So as I said, every Friday, last 6 years, I drive to Adelaide on a Friday evening. I have got a house in Adelaide. I spend time with my kids, then drive back on Sunday. And here we work as a team. So in 2004, I came as an employee to this clinic. And in 2010, I bought 50% of the practice. So that's kept me here. And as I said, I've got friends who live in Melbourne, in Sydney, and everybody used to ask me the same question. But I feel this town because, as I said, it makes you a complete doctor. And I'm passionate about medicine. I'm a workaholic, and I think if I go to Adelaide, I'll probably get bored very quickly. So it is, I think I was lucky. Everything worked out very well. Like initially when I came, the kids were small. My daughter was 3. My son was just born in 2005. So we used to do a lot of trips to the neighboring Port Broughton, Port Augusta, to the Flinders Ranges and thing. And over the years, as the kids have got older and they moved to Adelaide, I mean, and I remember like around 2012, I decided that should be a work-life balance. So what I used to do is every 10 weeks, I used to take 2 weeks off. That works with the kids' school holidays. And we travel. We go once to India a year. We go to America because my family lives there. And then one part of Europe or somewhere, and one local holiday. So 4 holidays in a year. Working with the work, it is going well. So I strike a balance between work and life. Living in Peering and working in Peering is best of both worlds. As I said, there is work where you learn a lot of things at work. You're really being a rural generalist. At the same time, there is a lot of things here locally, for my wife to be involved, for them to be involved with the family, to involve with the community. I used to play table tennis on a day. I play badminton on Wednesdays, table tennis on Tuesdays. Used to participate in lawn bowls on Thursday. But with COVID, now I ride my bike about 20 k's every morning. And most of the town knows me. And as I said, even my wife, and she works at the local kindy. So we have really been accepted into the community, and we never feel like we have lost anything, because Adelaide is 2.5 hours drive. If you want to go anywhere, it's not too far, and people have been friendly. So I think I've definitely got the best of both worlds, and I never regretted, and I don't think I'll ever regret coming to Peary or coming to a rural town. Yeah.